Hello, everyone. I'm going first, Lisa, because I have a big mouth.
You go for it.
I'm Jennifer Pearson. I am this year's ARSL president. I am also the director of the Marshall County Memorial Library in Marshall County, Tennessee, which is halfway between Nashville and Huntsville, Alabama. We have been closed to the public. I don't know for how long. I don't know what day it is. I don't know what month it is. I don't know what time it is. You're lucky I took a shower. This is the first time I've had makeup on in a month. Um, but we closed to the public mainly because I made a decision to close to the public. So I'm in one of those states where things happen rather slowly and there's not a lot of guidance. And so it's been a lot of sort of wading through on my own and figuring out what my peers are doing, because there isn't a lot of guidance here, and it's gotten better over the last 3 weeks or so, but there's not a lot of guidance here with a, you must do this and you can't do that. We're we're a state where we believe a lot in individual freedoms, and telling somebody what to do is not something our government wants to do. So they haven't been doing a lot of that. So, with that said, that's the position I'm in here. And at this point, they've closed the schools for the rest of the year. I don't know how long I'm supposed to keep the library closed. And so I'm just hanging out, waiting to figure out what my next steps are. Lisa?
Lisa Shaw. I am the chair of the Advocacy Committee for ARSL. I work with small rural libraries in workforce development with the Maine State Library. Maine has about 260 or so public libraries around the state, and Maine is a home rule state, which means that decisions like this is made by local governance, and our libraries are all locally run, locally funded. So we have about 55%, 60% that are 501c3s, but do receive money from the town and are board governed. We have the rest that are municipal departments, and a few that are kind of interesting hybrids where they're a municipal department, but they have a governing board. Go figure. I'm not going to say I've seen it all, because it's just inviting something else that I have not seen yet. But the state library, of course, is closed. We have a front-facing part of the Maine State Library that the public can come in and use. That is closed right now. Very, very few people going in there, and they're keeping their distance from each other. Most of us are working from home at this point. I think I saw a statistic that like 85% of Maine state employees are working from home now. And our libraries, we offer guidance, but we don't have any directives that we can make. So I do know there are a few rural libraries here and there that are still doing some kind of curbside pickup or something like that. But our governor's been really good about giving regular updates. Our head of the Maine CDC has become an absolute rock star over the last few weeks. And so we're getting very good regular updates, but we are not a department that can go and tell our libraries, whether they have to open or close. That is up to their local governance. But I can tell you that I think all of them are now, or just about all of them are closed to any kind of traffic coming in. And several are working remotely, although one of our large municipal libraries, Portland, has had to furlough quite a few employees right now because they're municipal. Yes, Carolyn, he's great. Dr. Shaw. At least that's what I was seeing in the news, that they've had to do that. But a lot of our 501s have been able to apply for the payroll protection program and keep their utilities and their staff going and everything. So we're kind of a hot mix right now. How y'all doing? That's a loaded question. Yeah, Ann Osborne is saying they, some places we can't advise. I assume everybody here is closed to the public. Is there anybody who's not and wants to own up to it?
In North Dakota, we have a couple public libraries that have chosen to be open for a couple hours a day. All that is allowed is very quick check-in and check-out. It's a completely local decision. Most of our libraries have closed and are doing curbside or delivery or some combination thereof. But we do have a couple that have stayed open.
And I'm seeing in the chat, curbside or closed through for quite a, at least through April 30th or May 15th, May 4th. Yeah. Kind of a variety out there. The biggest, one of the biggest discussions I've been seeing going around this is connectivity. People needing to use the Wi-Fi from parking lots. Do you have a lot of patrons that just don't have any other way to access services like filing for unemployment or anything like that, that are really struggling right now? Like what are some of the issues that you're seeing that you're like, oh my God, if this happens again, we got to fix this?
And I would add to what Lisa's asking, have any of y'all figured out how to help those people? Because I haven't. I don't know how to help people right now, other than we have Wi-Fi outside, but people who don't have their own computers, we're not doing anything for them because I don't know how. So I'd love to know if somebody is.
This is Patty.
Hey, this is Jennifer from North Liberty, Iowa. Oh,
This is Patty from Kansas.
sorry. And we just,
Jennifer, can you hold up for a minute? And a reminder to everybody that there is some time delay. So if somebody inadvertently talks over another person, it isn't intentional. Patty, go ahead.
We have learned that there are places in our state where some communities have actually put hotspots all over their towns. Some of our largest cities have traveling bookmobiles, and they are putting their hotspots in particular locations throughout the day. And of course, they're becoming overloaded. Kansas has a high problem with unemployment right now, but also our unemployment infrastructure is not up to snuff. And so it's been down more than it's been up in the last 3 weeks. But we are finding that some communities are solving the problem in that way. I live in the center or western half of the state, and we have whole pockets where you have to drive to the top of the hill to get anything. And so I would say for 3/4 of the libraries in the state of Kansas, we're dealing with connectivity issues big time.
We do have hotspots that we actually circulate. So those are gone. I am in Minnesota, and our libraries are funded with city and county dollars. And everybody sits in our parking lot, which is fine. That's what it's there for. My question is, how are you going to protect your employees when you reopen? How are you going to reopen? We're thinking about doing a phased reopening.
Yeah, we'll be looking at that as well. Jennifer, you had a comment too, Jordebrek.
sure. Hi, everyone. We are close to the public, and our staff are alternating days where we're coming in, and we have continued our library hop service where we put materials in people's vehicles. And just a couple of days ago, we started offering a laptop hop service as well. So it's the same premise. We take a laptop out to them, put them in the back of their vehicle so we maintain that social distancing. We're wearing protective equipment, and then we hold their keys or their license, and then give them an hour that they can utilize the laptop, and we have our wireless available out in our parking lot. So that is helping some people. We literally last week had a young patron, he was under a deadline, worked on his resume and submitted a job application Friday night, so or Thursday night. So that's how we're helping patrons that don't have wireless at their own place.
I'm noticing a lot in chat about phased reopening and then summer reading. So can we talk about both of those things? First, phased reopening. What does that mean to you guys? What do you mean when you say you're gonna phase it in? What does that mean?
I got it. I can answer that because I actually just came out of a staff meeting where we were talking about that. So this is Cindy Stanzak. We're in Michigan. And I saw that mentioned in the chat as well. For us, phased reopening is going to be in part mandated by the state. Our governor passed a new extended stay-at-home order that is very, very specific. And the state librarian or the Library of Michigan's legal counsel and one of the premier library law firms in the state have been issuing sort of interpretations of some of this. And it's basically, if you're not there doing something that has to be done in the building, you should not be there. If it can be done at home, it should be at home, regardless of the fact that I might be the only person in the building at the time. We're very likely expecting to see our stay-at-home finally end at the end of this month. It's been extended once, but then we're expecting to see that phased sort of reopening, whether that lasts 30 days, 60 days, or we're hearing up to 180 days potentially. So talking about that with my staff earlier, we're sort of talking about contingencies, like what would it look like if we opened under this option or this option? And so for us, we're talking about what if we were, the stay-at-home was lifted, but the places of public accommodation, which is the initial order that we were closed under, stays in place. So staff could report, but we couldn't be open to the public. So what does that mean in terms of it means curbside or virtual programming. But beyond that, there's also an order that limits up to 25%, maximum 25% of fire code for any business right now. So we would have to look at how many maximum people would we be allowed to have into the building at any one time once our building does reopen to the public. Somebody had mentioned public access computers by appointment. I really like that idea because we were trying to figure out how to do all of that. But we will probably see a maximum number of people or percentage of people in the building at any one time as part of a state order, and then that will lighten. But we're thinking that, to a certain extent, masks are going to become dress code. But legally, we've been advised we can't require the public to wear them. We can only request and make them available. So a number of my staff are working on various masks at home so that we have a stash to make available to the public to give them absolutely no reason why they wouldn't wear one. But yeah, so for us, phased reopening is going to be, to a certain extent, mandated by the state, but we're also expecting that there's going to be a limit on number of people in the building before we're able to completely reopen to the public.
Right now, the only people allowed in the library is me. And department heads are the only one allowed in our buildings. We had a discussion this morning on, from this point, our city council has agreed to pay all the employees through May 3rd. But once we hit May 3rd, what do we do? And Minnesota, he has not extended, the governor has not extended it. There's been talk that he'll extend it to May 12th. But then at this point, I'm going to be looking at furloughs and layoffs.
So Peggy, are you a town department? Is your library a town department?
Yes. We're supported by city and county funds. Minnesota has a maintenance of effort where they're mandated to give us X number of dollars. Our state dollars goes to our regional library system. We do not see that.
Has anybody applied for the payroll protection program? that wants to talk about their experience with that?
Yes,
Jenny?
I'm in New York and I applied. We were accepted and now we have other paperwork, of course, to do. We have to, they are recommending that you set up a separate bank account, which I was a little reluctant to do since we're used to dealing with restricted grants and tracking money very carefully. But we had a board meeting last night and they decided to go ahead. So I just sent all that information last night to our bank. But they're running around with their hair on fire trying to get this stuff organized. And I just read something, I don't know if it's true or not, that fund is already running out of money. So I think if you haven't applied already, I wouldn't say don't do it. I suspect they would add more money to it, but nobody knows. The application was incredibly simple. It's just payroll information. Yeah, surprising. You just had to have proof of payroll information and some other stuff that you have on hand if you've ever written any grant before in your life. And now we have to go back and fill in some blanks because it keeps changing. So, but it's nothing onerous. And we are a 501c3 and we're an independent nonprofit, which is what allowed us to do that. And our rationale for this, we have the money in our budget to pay people, but we're very likely to be cut for our contracts with our town. And our next budget vote that comes up, we're not going to be getting that money. So we're looking ahead to the way we use our money in our budgeting, that this is, fundraising, that's going out the window.
Are you going to continue to pay your employees then with this payroll protection plan?
You have to. That's the whole point of it. And we're paying our employees anyway.
We are too, but the city can't.
Because we're a nonprofit, we don't have to, deal with the town saying we have to lay people off or anything. My employees are all still working either remotely or occasionally. Some people have projects that they're doing in the library. So far, New York State has not cracked down on, a 5,000 square foot building with one person in it. So we've been able to continue doing a lot of stuff both there and at home. So I've been able to really justify paying people. And I'm going to fight for that till the last dog is hung.
I agree with you.
Sorry, we've been clear though, as part of this conversation, that the PPP is only for 501c3s. If you're a government organization, you can't apply, like a lot of us are, you can't apply for it. It's only
Right.
happens to be a 501c3.
Yeah, from what I'm seeing, and this is going to vary all over the map, but I think the municipalities, the government units are having to go through like the emergency management agencies to try to recover anything from there if they can make the case. But I think, probably, a year from now is when we're really going to feel the kind of sonic boom from this, economically. So having said that, in addition to your short-term plan for reopening, phased reopening, what kinds of discussions are you having with your boards, with your staff, with each other about making your case for the next budget cycle?
Our budgeting starts next month, which is probably not an opportune time.
Yeah.
Because every department in the city's budget starts next month.
Yeah.
I think it'll be like 2010, where they were looking for budget cuts and the easiest one was the library.
And yet, this has been the one department that people have been scrambling to for resources through all of this, whether it was for schoolwork, whether it was for, applying for unemployment or grants or whatever it is that they needed to do.
No matter what governments, city and county governments speculate, we are the one department that sees more people within our county, within our city, than any other department. We affect them the most, we touch them the most, and we supply them the most services. But you're considered a non-essential service. The only thing, in 2010, I had an excellent finance director, and she gave me some very good advice, and it did work. If I have to cut my budget, it has to hurt. The public has to see something that cutting the budget interrupted some inconvenience that happened to them. If they don't see that inconvenience, you'll never get your money back.
It's risky, but I have seen others do it. Judith.
This is Judy from Smithville, Texas. And one of the things that our library has served is the city itself in terms of getting laptops so that staff can work from home, making sure that they're connected so they can hold Zoom meetings and things like that. So just on a technology basis, I think that will help when it comes to budget time and they see what we've been able to do and what more money will make us capable of.
The other thing that we've been recommending to our libraries is, as you are working from home, take this time to document all the different services that you provide and the things that you do, because your board may not know it and your funding partners certainly don't know it. And if we don't shout from the rooftops, nobody is going to do it for us. And we as a library community are notoriously bad at shouting from the rooftops, but there are going to be so many people shouting from the rooftops for the dollars that are available that you have got to be louder, more proactive, earlier, quicker, and data driven. I mean, keep those stats. And now I'm talking, you know, as a state librarian who's going to have to deal with the annual report next year. Well, I don't have to, thank goodness. Someone on my staff does. But, you know, we're already starting those talks internally because stats next year are going to be so incredibly wonky. But use those stats to tell your story to your funding partners. Judy, I applaud you for being proactive in providing those services to the city. But even if that's not an opportunity for you right now, be working on those elevator speeches so that anybody you come in contact with, you can bore them to tears about how awesome your library is.
I'm seeing some chat, just backing up what Mary was saying in the chat about collecting stats for virtual program attendance and things like that. I might normally, when I'm in my actual office, I share it with our state data coordinator. So she's been having a lot of these discussions too about capturing usage statistics. I don't know how well set up a lot of you are to capture wireless usage accurately. Are you all in pretty good shape for that, or kind of all over the place with it? Seeing a lot of nodding, some looks like y'all are in pretty good shape. Starting to, yeah. No, yeah, I gotta tell you, Maine's kind of all over the place. We have some that are doing a really good job and some that we're still doing the counting people using laptops, which is, yes, the chat posts will be saved as well. I see that IMLS is putting out some grant funding, or looking at some grant funding for communities having to work with their libraries to do this, to get additional connectivity, whether it's, you know, whether it's hotspots, whether it's a relay of some kind or a repeater or things like that. Has anybody been looking at that yet, you know, to make that case down the road? But if you guys want this connectivity, if this happens again, you're going to need us and you're going to need to work with us. Usage time, but not much else on Wi-Fi I'm seeing.
Yeah, this is Judy from Smithville, and we lost our Wi-Fi in the last couple days. So I've been scrambling to try and get it back in service. And It was an older router, which we weren't able to use the router to count the Wi-Fi usage. So at least hopefully with this new router, we'll be able to access the data from there.
I have a question that goes along with the IMLS funding, because I've been thinking about it, and questions keep getting asked, at least to some of us. I'm sure you guys have probably been asked questions, but if you could wave your magic wand and say, hey, I think IMLS needs to spend its money on bleh, what would that be?
Jennifer, thanks for asking that question. Part of the CARES dollars are going to go to the state libraries through the grants to states programs. We just had a conversation this morning internally, and we're going to be reaching out to our libraries. But hearing directly from, you know, the horse's mouth, so to speak, I'm not calling you all horses, but you know what I mean, is going to be incredibly invaluable, and I can take it back to other state libraries.
Bailee, did you have something you wanted to add in there too? Thought you had something you were going to say. Yeah, so some of the stuff that I'm seeing in the chats too is also stuff that the FCC is looking at as well. My personal opinion, for what it's worth, is I'd like to see a little more collaboration among these agencies going forward. And similar to what Jennifer's been asking, for lack of a better word, what's your big takeaway from all of this? Like, if God forbid we find ourselves in this situation again or something similar, like, what are a couple of things or one big thing that really need to be fixed? What are you like, oh my God, I wish this had been better prepared going forward?
I've got a couple of things on that. Our community has a lot of really wonderful partnerships and programs.
I think you got muted there, Kristen.
I am unmuted. Okay. One of the things we're looking at is definitely strengthening partnerships. We have not traditionally had a strong partnership with the schools in our areas, and there are different food assistance programs, and I think we could do more to be a connector for all of those and becoming kind of that communication hub for everyone, and that would really be useful to our community, because all of these services do no one any good if they don't know it's there.
Karen Holtz, you had something you were going to say too?
Sorry, not really. I was talking to somebody my bookkeeper just walked out of the thing, so.
Another human. Wow. That's awesome. Just looking in the chat here too. Yeah, rural broadband and different things like that. So one thing that came up in a discussion I was having with somebody the other day, and I hope this is never an issue, but I'm wondering if any of you have been thinking about it too. As we think about reopening and having people back in the building and the concerns of, you know, another round of this hitting in the fall and in the winter, have you thought about the possibility that in the name of the greater public health, people will approach you trying to access materials records, like who's handled this book kind of a thing, to try to track a virus? Has that been on anybody's mind at all?
This is Cindy Stanczak again. I would push them off immediately, especially on the basis of the information that we received from that IMLS, CDC, Library of Congress thing, that that in general books after 24 hours are not a significant or really in risk of transmission. beyond the fact that at least Michigan actually has library law, like library privacy law on the books. They would have to produce a search warrant one way or the other. Once a search warrant is produced, then we probably can't argue with it. But yeah, I mean, we're planning on probably isolating our items for 24 hours, wiping down the covers anyway, wiping down the individual DVDs and their cases before they go out. So thankfully, I think that at least for us, we're not saying that that's, I'm not anticipating that to be a risk, but I mean, they wouldn't be able to say really that they got it from us, let alone, you know, maybe the grocery store or the drugstore or wherever it is that they went, unless it's literally the only thing they've done. And then for all they know, it was the person who touched the door handle before them. So thankfully, I think that that's in all of this one thing that we perhaps don't need to worry about, that, or if it did happen, we could argue it off pretty obviously, citing science. Thank God for science.
Taking temperatures, somebody's asked. What are your thoughts on the ethics around that? That's referring to taking temperatures of people before they come into the building.
I know there's like, my daughter's daycare is requiring that, and some places are requiring that, but I mean, I don't know how you could get by doing that at a library.
Our Capitol's requiring it. They're at our Capitol building is by appointment only, and even Capitol employees. So like I work at the state library, I had to go in the Capitol. I had to stop. They did some kind of body scan, and then there was a list of questions. I had to say no to each of them, and I moved on my merry way. If I had said yes, then they would have taken my temperature. So I think we can do it. If the question is, how do you have the manpower to do it?
Just a quick aside, this is Richard Brookman from Kansas. OSHA has let those restrictions looser, so employers can take temperatures at this time, but you still have to do it in a private area. You can't do it out in the public. You have to take them to a room and take the temperature, then let them pass through. But we're at this point in time, temperatures are being allowed. When this ends, it will probably shift back, but that has been loosened by OSHA.
That is interesting. I can't even take my own temperature accurately. I'd hate to be responsible for doing somebody else's. So somebody was just asking, and there's no dumb questions, so please don't worry about that. Has anyone considered, well, I'm gonna scroll back up here. Let's see.
I can get it. It's still on my screen. Has anyone considered what to do if library items that have been out for extended periods of time don't come back? Any temporary forgiveness for patrons?
So you're not just talking about like, you know, whether it's clean or anything. You're just talking about straight up loss of municipal or you know, library owned materials. Is that? I'll let Elsa let it go. Let it go.
Yeah, we'll be letting it go. This is Jenny in Iowa. We've talked a little bit about it. In fact, I just really oddly, I'll just tell quick. I connected with someone on our governor's Facebook press conference today who lives in about an hour from here, and her library is closed and is not doing curbside. And she said she's really worried about her son slipping with his learning. He's already behind. And so I said, give me your address. I'll get you a card. We'll mail you books. And she is ecstatic, and I'm thrilled to be able to offer it. They'll be quarantined in the box on the way. And then I just said, hold on to them. Just hang on to them. And when your library reopens, send them back. Drop them off there and we'll get them back. So, I mean, there's only so much we're going to be able to do. Yay, someone has a new book.
And we've been thinking about it from the perspective of like most of our adult fiction or nonfiction books we're getting for like $15 or $18 a piece. Is the fight worth $18 for that patron and everyone else they're going to talk to about the fact that the library came after them for a lost book? Like, it doesn't seem like now is the time to be fighting that fight. Now, if they had like $400 worth of items checked out, that could be a different thing. But for one lost book, I mean, we were talking about that too. Like, what are the things that we can do? Like turning our barcode scanners around so people can scan their own card and scan their own books. What do we lose by doing that? We're not able to check the books for damage before they go out. And so if we miss damage that happened, or, you know, that we missed when the item came in, is it worth that $15? Our bigger issue is, and quite frankly, I apologize if this makes some of you itch, is that we're inspected and treated as necessary for bed bugs every 2 months. It was just part of our facilities plan. There's a need for it. It's good use of taxpayer dollars because it's safeguarding the safety of the staff and the inventory and the public. And so for us, we're like, okay, well, we can't check those items for bed bugs, but we're able to check them when they come back, because we're going to have everybody return items in the drop box and we can check them before they circulate again. So that's one way that we're, you know, if we can't check the book for water damage before it goes out, if it comes back and it's, you know, not usable, we're out $15, but we potentially keep that patron. We make a note, and if it becomes a pattern, then we talk to the patron about it. But for us, yeah, it's just not, $15 is not worth that patron goodwill.
I'm gonna jump in here and well, I'll first say going fine free is the way to go, if you can, so that this is not an issue for you guys. I can't imagine charging anyone a fine right now for anything. Let it go.
We're fine free, but we still have to charge if the material is lost. But we wouldn't,
Absolutely.
in this case, again, I agree
Yeah.
with you, but I
But
think.
how do you know it's
yeah.
lost at this, you know?
Well,
I mean,
again, yeah.
yeah. How do you know it's lost? I mean, I just wouldn't even charge for a lost book until you've been open again for 2 weeks, you know, but, so somebody was asking if we could discuss out loud making decisions about when you start doing group programming again. And I think that's a good one. Does anybody have thoughts about that, and who's making those decisions in your community? You know, in my community, it's probably going to be, for the library, me.
I don't know if anyone.
Just go with the general guidance. Sorry, I would think it would be best to just go along with other guidances in terms of what's allowed, when are groups of more than 5 allowed, when are groups of more than 10 allowed. And I'd probably wait to do bigger programs like 50 people or more until like there's a vaccine. Honestly, until we're basically out of the woods in terms of any kind of danger.
ARSL on our Facebook page yesterday posted a question: what's your wild guess about when we will reopen to the public, everyone? And that got an amazing response. And while there were the occasional optimistic folks, I'll choose to use that word, who were giving May dates, the vast majority were saying June, and a lot were saying July. A lot of people were saying July, and that's across the country. So that was a real eye-opener.
I'm in charge of our summer reading planning and programming, and for the time being, we have decided like that part of the program is completely scrapped. We won't be doing any in-person programs, whether they're small group or large group, for summer. Hopefully by fall, we can start looking at doing registration again and do small groups of maybe 20 or less, or more digital author talks and things like that, but it's just off the table until September or October.
Kristen, what state are you in? Somebody mentioned in the chat that, you know, when people are talking about what they're doing in their particular area, it'd be helpful to know what state you're in.
I'm in Minnesota, right on the border with Wisconsin. So we also have La Crosse, which is a larger metro right near us, and Wisconsin has been hit a little bit harder, and there's enough people that travel back and forth between the two that, and La Crosse has been, the public library on this side of the river has been very careful. They closed earlier than we did, but we're a smaller library, a smaller community. And I think we will also see a moratorium on any in-person programming there for quite a while.
I saw some discussion earlier happening around emergency plans. Did anybody have anything approaching this in their emergency plan already? How's that gonna look different for you going forward? Is that something that would be useful for ARSL to kind of share around if people do start updating those?
I think the thing about putting this in your emergency plan is that it's so specific because of the way that a disease spreads and the very specific things that we have to do to protect ourselves. I mean, having it in your emergency plan, it literally has to be your pandemic plan. It can't just be the library is closed for a month or more plan. Like, it's got to be specific, disease specific planning, which is hard, but and I don't know how worth it that is, because how often does this happen? Every 50, 100 years?
So Vicki in Indiana just posted that they have a new public health plan that they've written. Is that something that you're able to share, like with the listserv or anything, Vicki? To your name, if I say it, Vicki Bilta?
Yes, it's just like it looks, but no one sees that really. There are several libraries in Indiana have written what they have called a public health emergency plan. Our state level agency or our state Indiana Library Federation has been having meetings every other day for directors here. And so we've been sharing information, and that's where a lot of us got the ideas to develop these sorts of policies.
So if you had difficulty hearing that, she was saying that the Indiana Federation of Libraries has been meeting to put some new policy together. And Mary is saying in the chat that the governance committee will look at pulling together a template for a plan. If anybody has one, to email it to msuc@nd as in North Dakota.gov. And please put ARSL Library Emergency Plan in the subject.
And speaking of our state libraries as a resource, I know it's different from state to state, but you might check in with your state library. I know that my state library maintains a policy clearinghouse so that we don't all need to be reinventing the same wheels, since they're basically the bones of our wheels are the same, and we just need to tweak it to match our organization. So check out the resources of your state library.
And Mary just pointed out that ARSL also has one. What do you think are going to be some of the biggest changes to what we think of or what our patrons or the public thinks of as library services going forward? Do you think it's really doubled down to the importance of those print materials? Do you think we're going to need to put more into like our databases and ebooks in our technical structure? All of the above? What are you seeing? What's your experience so far?
This is Jenny. I think in North Dakota, I think we're going to see a lot more for both. I think people are going to realize the importance of having those materials. I mean, right now we have people commenting just like, oh my gosh, I'm dying without my library stuff. And then I think we're also, yes, the demand for virtual and offering digital programming and both programming and items or, things digitally is going to be huge. I have kind of a weird question to go along with that. That's, well, sort of goes along with that, maybe not. One thing that was brought up here, and we don't have it currently in our policy. We talk at libraries about like body odor and other things. And I know you probably all have this experience where I have someone come in and hack all over my computer and say, yeah, I just went to the doctor. I've got strep. I just need to get this one thing done. Or yeah, my kid, kiddos sitting at a computer. I'm like, hey, what's going on? I thought you had school today. Oh, I'm just out sick today. So we're talking, one of my staff said, can we do something in our policies? What can we put in our policies to just say, please don't come in if you're sick. Don't bring your germs to us. And not just with this, but going forward in the future. So I think that's something that people are going to be more cognizant of in general, is that social distancing may just become more of a thing. I mean, you know, it's easy now just to kind of go away from someone where usually you're drawn toward them. So I don't know. I'm curious if other people have things like that in their policies already, or thoughts on that.
Jenny, I think that's a really interesting point. And when you write a policy, can I just use yours because you write the best policies? But the main reason that we decided to close our library, or the thing that pushed me over the edge, was it was one Friday, I don't know, right when everything was coming down and people were making decisions. And I look out and everyone in that library is between 60 and 100 years old. And there are a ton of them. And I thought to myself, if I don't close this down, they're never going to stop coming. And I'm putting them in danger now. So, you know, so how do we deal with that? Because this is not a one-time thing, y'all. I mean, this is going to keep coming and coming and coming. And so how do, like Jenny says, how do you tell people no, or you can't come in because that's a tricky issue that I think we're all going to face.
So I did call my, sorry, Connie, I did call my, well, I mentioned this during a department head meeting, and first my city attorney told me his head blew up because he thought I was talking about right now. And he's like, aren't your doors closed? And I'm like, yes, my doors are closed. I wasn't meaning now, I'm talking in the future. And so he's like, okay, I didn't hear anything after that because my head exploded. But he's amazing, by the way. And so he did say, you know, libraries are that place where everyone has a right to be. And we know that, but there is also your right to say to someone, hey, you need to go out for the day or whatever, if they're a disruption or a danger to someone or whatever. So he is, I very scarily put my policies into his hands. Whenever I do that, he rewrites them. So he is looking at 2 of my main policies, my service policy and my conduct policy right now. So I don't even know what will happen when he gets them back to me. And I told him, with all due respect, I will look at what you have to say, but remember that I write my policies so that my staff can use them as a back, you know, to help them, but also to make decisions without them. So he's like, yes, yes. So I think, yeah, our policy should be pretty solid. I'll let you know what we come up with.
My question would be, how can we legally enforce that? And you're probably going to have somebody who's going to say, no, I'm not leaving. And it's a little different, maybe not, when someone has been verbally abusive or there's been some other issue. But I can see people saying, no, I'm not going to leave the library. And so at that point, do we call the authorities? What do we do? You know, we're kind of grounded in common sense that we wouldn't go out and expose people, but that's not always the thinking of everybody else.
The other issue is that some of they're saying now that you're asymptomatic and you could still have it. So you're sort of, you could have 2 people in the library, one coughing all over the place that just has a cold, and another person that looks perfectly fine that's spreading coronavirus everywhere they go. So I'm not sure we can do anything.
I think Patrick had a great point. He said, well, Patrick, why don't you say it? Because I can't find it now. It's gone from my thing.
Think I unmuted now. Yeah, so just it's the whole your right to swing your fist wildly stops at my nose. You can go out in public and do whatever you want, but if it's going to endanger other people, then that right isn't a right anymore. You don't have the right to endanger others.
But what are you going to do with somebody who doesn't want to leave? You've said it looks like you're ill, you know, you're coughing and sneezing all over the place. You could be a danger to others, and they say, no, I won't leave. How far are you going to go? Are you going to call the police on them?
So I think so. I mean, it's just like any conduct issue. You do what you need to do to get your policies in order, and it's a conduct policy. Then you're pointing at your policy. That's why you have it in policy. and why you have policies is so that you can use those to help support what you do every day, but both for the hard stuff and not, other things that we want to support our patrons, and it's to protect everyone.
I would argue though, not argue, I'm not arguing with you, Jenny. I'm playing a different side of the discussion. Just be careful. I did make a comment, and we have to make sure that we don't let our favorite patrons have a pass. And yes, every librarian has a favorite patron. So you're gonna have to be really careful of that. And you also can't give your staff a pass. If you're gonna start kicking people out because they're coughing, then you have a staff member suffering from allergies, they have to go too. And I know in our small libraries where there's such a limited staff, that's going to be tough. So just make sure your policies give you the teeth you need, but also don't hold you to the fire for something that you can't possibly enforce. And that's a hard balance to strike.
Yeah, and at what point do we become, people, health professionals who can diagnose what's a public hazard and what isn't? All the people who came in coughing in our last 3 days said, "Oh, I have allergies."
And that's why I brought it up, because I think this is a really hard balance and the one that we need to look at. We can't be health professionals, but I think we can. If someone, personally, if someone says to me, "Gosh, I just went to the doctor and I have strep," I'm going to say, "Well, you probably need to go home then. Why don't you tell me a couple things you want and go outside and wait, and I'll bring them out to you," or something. I don't know. I don't know what the answer is. I think we are all going to be looking more for what is safe and what's not, and what we can allow and what we can't.
I think one way to head off some of those conversations is to set up different avenues for people to get the services they need. If we have to ask them to leave the library, we can say, like, my library has not traditionally done a mail out or delivery service. That will be something we will be looking at now, because it's going to be one of those cases where if we have to ask someone to leave, then we want to be able to provide them with those services however we can.
This has been a really great discussion, and we're getting closer to the end of the hour. So I would like to ask, and you can say it out loud or say it in chat. These are going to continue, obviously, for as long as you guys keep coming and want to talk. Do y'all have anything specific that either this week, last week, or the week before, if you've been to all of them, that hasn't been touched on yet that you'd like to spend some time on maybe next week? I know we were talking a little bit about summer reading, but didn't get really into that. So maybe we should be purposeful about that next time. What else, you guys?
Understanding is that these meetings are held every week on the same day and time. Is that accurate assessment?
Yes, I'm pulling it up right now for the exact, but it's every Thursday at this time, 11 Pacific, 12 Mountain, 1 Central, 2 Eastern.
Oh, that's good. You rattled that right off.
Oh, I've got the web page.
So definitely seeing a lot of requests for summer reading, some requests for discussion on helping seniors. That's an interesting one. I was in a regional meeting with one of my very rural regions yesterday, and one of the librarians was saying a lot of her patrons don't have internet access and don't want it. And how do you service, and that's something I've seen on the listserv being discussed quite a bit, both statewide and ARSL, is how do you service people with no internet access and maybe they don't want it. And I'm also seeing requests for a discussion around copyright in ebooks.
And reopening, a lot more, let's talk more about reopening. Somebody said, where do you get your masks? I'll just put a plug in here. My sister-in-law is making them. A lot of people are, I think, now, but go out there and look on Facebook amongst your crafty friends and stuff. They're probably sewing the masks. And my sister-in-law is doing it right now because she and my brother are both actors, and there ain't a lot of acting jobs right now. All right, so anything else before we wrap up for this week? Cynthia, you had something?
Just on a side note, something that we maybe hadn't discussed is some of this innovative, out of the box thinking about the thing that came up at my staff meeting today is maybe we need to think about essential services, like what is an essential service of the library, and refocus on those things and focus on outcome rather than how we've always done something. Maybe it's like, what are identifying the essential things that the library can provide as a service, and then figure out new ways to get those. And one of them for me is I have to keep in mind, like, what is an appropriate use of taxpayer dollars and programming and donation and stuff. And for us, I started a mask makers group for our area, and we had donated supplies that the library had received that we were probably never going to use, at least anytime in the next year. Some of them, they were donated anyway. We've just been donating them. And I've got a bunch of my staff who don't have robust home internet, who have sewing machines and have research, like getting them the things so that they can make them available to have for staff, but also to have a stash available to hand out to the public, just like we would Kleenexes or hand sanitizer or toilet paper. These just happen to be things that are made out of like old t-shirts and quilting fabric or extenders with buttons. That to my mind, this is an effective and appropriate use of taxpayer dollars, is benefiting the public health. And so trying to coordinate that. That said, there is a national mask makers group on Facebook, but FYI, you might want to look for a more local one. That one has over 7,500 members and they get about 400 posts a day, but it's a great way to find patterns. But if anybody wants patterns, you can message me. Find me on Facebook. It is Cynthia Stanzak. And I will happily send you any of the patterns that I have and the various alternate materials that we figured out to make some of these, because chances are we're all going to be wearing masks for a long time, so we might as well be comfortable with them. So
I just want to give a quick shout out to, I've seen a couple of these come up in the chat, the new directors who have just started in the midst of this. Bless your hearts. And I mean that in all sincerity. You really had to jump in the deep end of the pool first thing. So please know that ARSL is here to help in any way at all that we can. Even if you just want to go, we'll scream with you. You got this.
Absolutely. Before we close out, Kate or Nim, do we have any housekeeping closeout or any closing things from you guys?
I don't believe so. If you're interested in facilitating one of these in the future, we're going to be having them as long as they're needed every week, every Thursday. Just email us at info@arsl.org and we'll get you paired up with someone. And thank you for coming.
Big thanks to Lisa and Jennifer for facilitating this week's discussion. Really appreciate it, you guys. Everybody keep well out there. Take good care of yourselves and each other. We saw the news today that across the country, we've topped 22 million people unemployed right now. So let's all look out for our neighbors. It's a tough time out there. We'll see you next week.
Bye, everyone. Thanks.